Dear professors and colleagues, it is my pleasure and honor today to speak from Urology and Nephrology Center about very hot issue. I like the way of speaking about preventive medicine. So primary prevention of chronic kidney disease through lifestyle modification, although we usually stress upon lifestyle modifications from diet, exercise, and stopping smoking, but today what is new? That we have this very nice article published in the end of August, so a couple of days ago. And this is a systematic review and a meta-analysis for 104 studies, more than 2.7 million participants. And through this meta-analysis, there was correlation between dietary factors, physical activity, alcohol consumption, and tobacco smoking. And as you see, this table summarizes the exposure, number of studies, number of participants, and the association ratio, heterogeneity, and evidence quality. I'm going to highlight them one by one. So this is regarding vegetable intake. What do you see? The odds of incident chronic kidney disease is significantly reduced because the diamond here is away from 1, below 1. This means increasing vegetable intake is associated with primary prevention of chronic kidney disease and reducing odds ratio for occurrence of chronic kidney disease. Good news. The second point, potassium intake. As you see, it is green color, means that I'm advocating so increasing potassium in the diet through fruits, vegetables, and the sources that already known, like fruits, banana, potatoes, and others, tomatoes. So encouraging potassium intake is a good intervention in the diet, is a good intervention to reduce the occurrence of chronic kidney disease as primary prevention against chronic kidney disease. And potassium is antidote for sodium. Physical activity, again, odds ratio for chronic kidney disease is reduced by encouraging physical activity and exercise. This in comparison to sedentary life, who should advocate physical activity and encourage physical activity and warning against a sedentary life. The color is now is red. Sodium is bad. Increases the odds of incidence CKD by this percentage above 1. This means moderate sodium restriction is good for the healthy kidney, and to reduce chronic kidney disease, we shouldn't be over consuming sodium and to avoid adding salt to our diet. Tobacco smoking is associated with bad outcome, with increased odds of incidence CKD. This is why we should encourage stopping smoking, avoiding smoking, and I always say, even avoid exposure to smokers. And this is the table that summarizes the different evidence of quality, and I'm going to highlight them in one of the very nice figure. Please focus on this figure because these are the lifestyles, and these are the outcome. Incidence of chronic kidney disease. If we reduce incident chronic kidney disease, this means we are seeking for primary prevention. Reducing kidney replacement therapy, reducing GFR decline, or albuminuria, all these are outcome. So let us focus on the style and the impact or the effect of modification. The blue color here is protective. So diet rich in vegetables and potassium and encouraging physical activity and reduction of alcohol or moderation of alcohol, all these for alcoholics. We are not alcoholics here in Egypt. All these are good style for reducing the incidence of chronic kidney disease. Diet rich in sodium and the style of smoking, tobacco smoking, both of them are bad because they are red. Red means harmful, increasing the relative risk here, sodium by 21%, smoking by 18%. Again, vegetables reduces the risk of CKD by 21%, the potassium by 22%, reducing CKD, physical activity by 18% reduction of CKD, and then increasing sodium is associated with 21% increase in the risk of CKD, tobacco increasing the risk by 18%. So this is clear for primary prevention. Let us go to kidney replacement therapy. This is no available evidence. Here it is protective, but less than this. More than 50% of studies suggest protective effect of potassium and physical activity. And here, suggestive harm, 50%. If the diet is rich in sodium, this will increase the risk for kidney replacement therapy and dialysis and transplantation. Again, tobacco is bad. Smoking is associated with significant increase the need for dialysis and transplantation. What about declining of glomerular filtration rate? This is the protective, the blue color is protective, and this is no association between vegetables and the GFR decline according to this meta-analysis, although I encourage for primary prevention of CKD. For the potassium is beneficial to reduce the decline in GFR. Physical activity is the same, is associated with significant reduction of decline of GFR. It's protective to reduce the progression of chronic kidney disease. A diet rich in sodium is associated with some harm. It is like 50% of the studies suggestive of harm, and then tobacco here is not significant, no association. What about albuminuria? If you go, the most important factors associated with reduction of proteinuria is encouraging mobility and physical activity, and the harmful is smoking. So let us focus for the general population on lifestyle modification because it is a window for prevention of chronic kidney disease. I should stop at this point. Thank you very much for your attention, and I hope if you have any comments to write it to the YouTube the video after it's uploaded to the YouTube. Thank you very much. Hoping you the best health and the best kidney. Goodbye, and thank you.